Hi, everyone. Today we are so thrilled to have Dr. Dan Spratt with us. You may know Dr. Spratt as the lead physician editor of our prostate cancer patient guide, which I have here, or as one of the faces of our prostate cancer information video series. Hi, Dan.
Hi, how are you doing?
Doing great. Thanks for being here. So at the University of Michigan, Dr. Spratt is the chief of the genitourinary radiotherapy program and associate chair of clinical research in the Department of Radiation Oncology. He's also co-chair of the genitourinary clinical research team and co-director of the spine oncology program at the Rogel Cancer Center. So he sees patients in clinic, and he also leads research projects in many areas related to prostate cancer. So today we're going to get an update from Dr. Spratt on how COVID-19 is affecting the care of patients with prostate cancer. Dan, you were a key author of recommendations for radiation therapy in prostate cancer very early in the pandemic, and we also worked together on updating PCF's patient guide with information about prostate cancer care during COVID-19. What do we know now that we didn't know then, and what has changed for men with prostate cancer?
Well, this is absolutely a subject that is constantly changing, and I think will continue to change sort of our viewpoints on how best to handle this in the months to come. Initially, we'll say around March, especially when the pandemic, and we'll call it the first wave, was really rising pretty rapidly, there was a great concern to men with prostate cancer, given that we very early on were recognizing that patients of older age, or just people of older age, were more likely to have a severe outcome or even die from COVID-19. As time went on, we started to see some differences in that men appeared to be dying at a higher rate than women of COVID-19. And again, pretty rapidly, and that's been refined, that patients with comorbidities, things like heart disease, lung disease, some studies have shown obesity or high blood pressure, but all have been pretty consistent in that patients with cancer seem to have more likely a severe outcome or even die of COVID-19. And so patients with prostate cancer, many, but not all, happen to be men of older age. They are male and have cancer and potentially other comorbidities. And so there was a lot of concern about bringing those patients into the hospital, potentially increasing their risk of exposure from COVID-19. And so initial guidelines that we put out and others have put out was really recommending making sure that treatment at this moment is really critical to that patient's overall survival, their overall outcome, because you now have two things to juggle, where normally we're just talking about personalizing care of the risks of our therapies to treat prostate cancer and the benefits of those therapies. But now what we're talking about is what is the potential benefit of delaying treatment to let that first wave of the pandemic simmer down, to calm down, versus the harm in delaying your treatment. So that risk benefit of harming of the cancer by delaying it versus the benefit of delaying of being exposed to COVID-19. And so for radiation, it was really recommended to either hold giving radiation or to use very short courses. We call those SBRT, or 5 treatments of radiation when possible. Often things like procedures such as prostate surgery was not being performed, especially in places with a lot of COVID-19 incidents going on. And then certain therapies like chemotherapy, which could potentially be immunosuppressive, was often not recommended. But fortunately for our men with prostate cancer, those who would normally be recommended hormone therapy or androgen deprivation therapy, ADT, that actually is something that maybe has multiple benefits during COVID-19, one of which was just to delay the need of therapy because it kind of suppresses the cancer. Some people would say in lay terms, just put it to sleep. So you could delay the need to have radiation or surgery. And then there's some exciting research that the PCF's involved with and others about there may actually be intrinsic benefits to reduce the transmission or severity of COVID-19 from being on hormone therapy. And so really what has happened as things have now calmed down over the subsequent months, I think most of the treatment has, I would say, largely returned to somewhat normal, but there still is an emphasis, and I think it's going to be something here to stay, that is really trying to figure out how to minimize patient trips and exposures to the hospital with or without COVID-19 being present, and how do you give value-based radiation, in the shortest course you can. How do you make sure your treatments with urology can be, again, as short as possible? And what visits can we do through virtual care, kind of what we're doing right now? And so about half of my patient visits now are still virtual. And it simply, I think, reduces throughput and exposure to the hospital setting. And I think it's something that adds a lot of patient convenience for a lot of them.
Sure. Thank you so much for that. You covered a lot of ground in that answer, kind of all of the 6 months, and so much. We've learned so much that I think will be reassuring to patients and their caregivers. Let's break that down just a little bit more. And you mentioned this at the top of your answer. So this interaction with cancer and COVID, how does actually having prostate cancer affect a man's risk for getting COVID or of severe disease?
Yeah, so it's not clear that having prostate cancer will change your risk of getting COVID-19. But what seems to be clear, and it's, again, I wouldn't say there's good data to say it prostate cancer specifically, but cancer in general, patients who have active cancer seem to be at much higher risk, could be 2 to 3-fold more likely to potentially die of COVID-19. And so I think that that's something that clinicians, take very seriously, especially given for localized prostate cancer. Many of these men will not die of prostate cancer. They may die of something else. And so the last thing we want to do is potentially increase their risk of COVID-19 even by a little bit. And so I think really trying to personalize the estimates of the risk to the patient is critical right now.
Absolutely, absolutely. It's a very individual decision. And in terms, you touched on the different treatments for prostate cancer. Obviously, the good news is that men with prostate cancer have a lot of options. How do the different treatments maybe affect a patient's risk for COVID infection and complications? You already mentioned ADT, and there's obviously many others.
Yeah, so the data, again, is not all of it agrees with each other. And so this is where, again, continued information is going to be critical. But there has been reports that patients undergoing surgery, not that the surgery itself is a risk for COVID or COVID outcomes, but being in the inpatient setting often you have to spend a night in the hospital, being around often many more staff. It's been shown that healthcare workers are at significantly higher risk of contracting COVID than the general population. And so there's been some studies done showing that patients getting surgery are at higher risk of contracting COVID-19. I think that was especially a concern when hospitals were really full of COVID-19 patients. I think right now that risk is largely subsided and is not, I would say, nearly as much of a concern. Plus, there's ways that many hospitals have adopted, including a lot of patients before they undergo surgery, undergo COVID-19 testing. And so to make sure that you're not operating on someone and intubating them and potentially aerosolizing that they don't have COVID-19. So I think that's substantially reduced the risk. Radiation has had minimal effects, I think, when you're talking about shorter courses of radiation. And so, sometimes radiation can be given in 8 or sometimes people give 9 weeks, so 40, 45 treatments of radiation. That's a lot of trips to and from the hospital, and that's a lot of a potential exposure. I think that what we've adopted in many centers is doing shorter courses of radiation, typically 5 treatments. And we have essentially put in place, I think a lot of centers have done this, where we now have very few staff and patients in our department because most of the visits are either virtual or the staff that can work from home and do their jobs are home. So the exposure to the patient now is extremely low. Plus we have people, everyone's wearing masks and screening at the door. And so I think that risk, again, I wouldn't say it's 0%, but it's extremely, extremely low. And finally, there's the systemic treatments that typically medical oncologists give, and that range from just oral types of hormone therapy pills or injections of hormone therapy. But as we mentioned, there are therapies that can potentially be immunosuppressive, things such as radium, could be chemotherapy, there's a couple agents. Some of the new drugs, such as PARP inhibitors, can affect blood counts. And so I think these are things, especially when you need to give corticosteroids with certain drugs, which can potentially lower blood counts. These are things I think medical oncologists are paying a lot more closer to attention now, given the risks of COVID-19.
And that's great to hear that we've learned so much, and that many of the treatments actually place patients at relatively less risk, maybe than they did initially. That's wonderful news. You had mentioned that much of the care has gone back to normal, more or less. If a patient is told that his diagnosis or treatment may be delayed due to concerns about COVID locally, what questions should he ask his doctor, and should he maybe even consider traveling to get care sooner?
Yeah, so excellent question. And I think this is something a lot of patients right now have various types of anxieties, and it goes from the anxiety of coming into the hospital when it could be very safe to exactly what you said, where they potentially may need to be delayed due to certain processes or procedures put into place, and so they may have some delay in getting their treatment. For patients diagnosed with what we call localized prostate cancer, where we believe it's confined to the prostate gland and is not metastasized, there is very good evidence that treatment delays, in some studies even out to 6 months, there is no jeopardy in terms of their cancer control outcomes, meaning their chance of being cured. And typically in patients that even are on the more aggressive side of localized prostate cancer, we often, if we feel their treatment's going to be significantly delayed, it is often recommended to give them an androgen deprivation therapy to kind of, again, sort of put a pause on the cancer from progressing until they can have their treatment, if it's going to be significant delays. When you get into patients that have metastatic prostate cancer, that is something that typically we want to, especially if they're symptomatic, they have bone pain or other, more acute issues. Typically, again, the standard of care is starting them on some type of hormone therapy. And so I think that for most men with prostate cancer, it's either extremely safe to delay treatment, and even for months. And again, some patients with low risk prostate cancer, most of them we do not even treat initially. We put them on active surveillance, where you don't even intend to treat them potentially for years. So it's very safe. But in other patients that have more aggressive disease, I would say the first step would be starting on hormone therapy, which can be given typically in an outpatient basis, an injection. There are some oral forms as well, and that can, prevent them or avoid them from needing to come into the hospital frequently for other therapies until it becomes safer for them to come in for treatment.
Wonderful, thank you. That is reassuring. That is reassuring news for sure. What advice in general are you giving to patients for their sort of general and overall physical and mental health during this time?
Yeah, I think right now there's a lot of manifestations from COVID-19. There's obviously the health aspects, but there's also a mental and psychological aspect where a lot of people are now lonely, they're alone, they're not socializing. They may have economic or socioeconomic issues from either loss of job or other things that have potentially gone on. I think there's a lot of stress and potential depression that's going on, and you compound that with potentially a new diagnosis or an ongoing diagnosis of cancer. I think that there's a lot of patients with anxiety or depression going on. And so what I talk to my patients about is, number one, focus on what you can control, and, eating well and having an active lifestyle. So even if, let's say, the gyms are closed or other things you like doing are closed, the outdoors is always available to you. And I think that finding new hobbies, especially physical activity, is fantastic for men. I think it's been shown that You know, COVID-19, as everyone jokes, you know, you're going to gain weight, the COVID-19. I think that obesity has been shown to not only increase men's risk for developing prostate cancer, potentially even of dying of prostate cancer, let alone heart disease and other common aspects. So I think physical activity, decreasing stress levels, finding things you enjoy, eating healthy, I think that's sort of right now, you know, things to sort of, those should become your hobbies now that potentially, hopefully, you have more time to focus on those priorities.
Absolutely, totally agree. And I'm glad you mentioned the importance of healthy eating and the potential concerns about obesity. The Prostate Cancer Foundation has actually been running a 30-day healthy eating challenge during September, which is Prostate Cancer Awareness Month. We agree that it's really important to get the word out and to give people some practical tips about how they can incorporate different foods into their diet. If folks who are watching are interested, please join us. It's not too late. You can sign up and learn more about our 30-day healthy eating challenge. It's called Eat It to Beat It, so to beat cancer and other chronic diseases. You can sign up at pcf.org/eat, and it's never too late to get started to adding healthy and high fiber foods into your diet. So let's just do a quick lightning round here and touch on a couple things that we haven't mentioned yet. I know your specialty is radiation therapy, but you do touch so many aspects of prostate cancer in both your practice and your research. So if you are a patient on active surveillance, is there anything you should be doing differently?
I would say no, other than, like I said, focus on physical activity and diet. I think you should keep with PSA testing and the active monitoring part of it. Nothing you should change.
Perfect, thank you. Speaking of PSA testing on active surveillance, what about men, about screening? Should men continue to get PSA screening tests who have not been yet diagnosed?
Yeah, assuming that your local area COVID rates are low, which again, it varies by time and location where you live. I would say the risk, if you're wearing a mask, of getting a PSA blood test is a very low risk setting. So I consider that reasonable to continue to get your PSA tested for screening. If you're in an area, if you're having a big wave, a second wave right now going on, I think that it's very safe to delay that blood test until that peak sort of passes, that wave passes, to get the test. You know, PSA screening is not something that is ever an emergency or an urgency. It's something to you know, get routinely, and that can easily be delayed months, potentially even a year. It would not cause any problems.
That's great to hear. Yeah, so you can delay it, just don't forget about it.
Yeah.
So obviously we won't use anyone's name, but can you tell us about a particular patient that you've seen in clinic maybe recently that stands out in your mind kind of relative to COVID and treatment?
Yeah. So, you know, we developed, I kind of talk about an app we made that's called Oncovit. It's an app we made that factors in patients' information about the risk of potentially getting or potentially dying of COVID versus the risk of having worse outcomes from their prostate cancer treatment. And I've had many patients that are concerned about coming into the hospital, given just the overall concern of what's going on with coronavirus. And what's been very helpful is to help quantify that in more objective measures that they can understand. And, you know, typically, you know, it's rates of increased risk that is probably lower than going to the grocery store, you know, by coming in, at least right now at the University of Michigan in Ann Arbor. Now that was probably a different story in March when rates were much higher. And so I think sometimes quantifying that risk is extremely helpful for them to understand the safety, as well as understand the precautions that we're going to make sure that staff and patients are all protected, to make them feel reassured that they can come in and not have extra anxiety about getting treatment. I will also say, just on a quick note, that during the peak of the pandemic, I had patients that were frustrated that their treatment was being delayed. And I think models such as this Oncovit app have proved to be very helpful to them, because I could show them that while I could treat them now, their outcomes would be no different than if we delayed it 3 months or 4 months. And their potential risk, given that many men that I treat are 60, 70 years old, potentially with other health problems, that their risk of, if they get COVID, of dying of COVID is non-insignificant. And I would say that I would be causing them more net harm by bringing them in than delaying treatment. And so I think sometimes having a more quantitative way of balancing those risks and benefits is very helpful to patients to know that you are thinking about them as a person, not just their cancer. And I think once you can relay that to them, usually, we get on the same page.
Absolutely. So important to consider the whole person, because each one of your patients is different. And now we have numbers to kind of quantify all of that.
Yeah.
Well, this has been wonderful. Is there anything that we haven't discussed that you think patients should know about their care?
Yeah, I think it's important for patients. I know there's a lot of different beliefs that everyone has in the country and probably the world right now. I think it's really important for patients with prostate cancer to make sure the basic, hand hygiene, social distancing, and wearing a mask. Generally we have phenomenal outcomes and treatment options for men with prostate cancer. And just like we normally tell them to consider making sure their other health problems or risk factors are reduced, you should also make sure you're reducing your risk of COVID-19. And so I think that, them doing their part will help us to be able to treat their cancer more effectively. And overall, we want all of our patients and men with prostate cancer to live long and have great lives. And, we would hate to see any of them contract COVID-19 and have a bad outcome. But know that their doctors, if treatment delay is happening, just, it's always fine to ask them, is this going to hurt my outcomes? Is this going to jeopardize my outcomes? And hear what they have to say. And if you're not satisfied, you should always seek second opinions. No doctor should have too big of an ego that you can't get other opinions. But always feel free to ask your doctor, because there may be a very good reason for it.
I think that's great advice. Thank you so much. It's important for men to really communicate, like maybe even over communicate in this time, because we can't see each other face to face.
Absolutely.
Wonderful. Well, Dan, we thank you so much for all that you're doing to take care of patients, as well as to lead research projects that are really advancing the care of patients behind the scenes. And we thank you so much for your time, and we'll let you get back to your good work.
All right. Well, thank you so much. I hope you have a great day.
You too. Stay well. Bye-bye.
Bye.